Hoshiarpur, Punjab. I am here on the occasion of Ayush Vibhodhini webinar, third and last series, sixth day. I would like to welcome and thanks our Institute Chairman, Sir Engineer Amarjit Singh Walia, all our management members, our principal ma'am, Dr. Minakshi Nath, our vice principal ma'am, Dr. Mridhu Sharma, and all the teaching faculty of our college, all dear students, and all other delegates. I welcome all of you. I would like to thank you, all of you, for giving me your precious time. Dr. Ganesh, are you able to listen? आवाज आ रही है
Yes,
आपको?
yes.
Okay. Thank you. Uh, nowadays, our lifestyle has changed a lot, and we are suffering from many lifestyle disorders or disease. Lifestyle disorders are the ailments that are primarily based on the day-to-day habits of people, habits that detract people from activity and push them towards a sedentary routine can cause a number of health issues that can lead to chronic or non-communicable disease that can have near life threatening consequences. So on the base of these, on the base of today's habits, we have choose today's topic in Swasthvritta, that is lifestyle disorders. The most common lifestyle disorders are cardiovascular disease such as hypertension, heart attacks, and strokes, COPDs, diabetes mellitus, osteoporosis, and one common is obesity. Obesity is just another lifestyle disorder. Leading cause of lifestyle disorders are like poor nutrition, lack of physical activity, lack of sleep, chronic stress, smoking, and excessive alcohol consumptions. In view of all these, we have choose topic role of Swasthvritta in lifestyle disorders. Now I would like to introduce our keynote speaker, Dr. Ganesh Awad, MD, Swasthvritta. Dr. Ganesh has passed his BMS UG from Aryangal Medical College, Tara. He has passed his PG from JGCO Ayurvedic Medical College, Ghatprava, Karnataka. Now he is working as a internationally acclaimed young dynamic consultant in the field of preventive diabetology and lifestyle disorders by the scientific and evidence-based Ayurveda. He has accumulated advanced medical knowledge in the field of diabetology from various countries like Belgium, London, Singapore, Europe, Netherlands, and Middle East Asia. He has also memberships of various associations like American Association of Integrative Medicines, American Association of Clinical Research Professionals, International Society for Complementary Medicine Research Germany, Clinical Research Associate. He is working as an associate in Institutes for Treatment and Research in Diabetes and Endocrinology, Pune, Maharashtra, India. Now I would like to request our Vice Principal, Ma'am Dr. Mridhu Sharma, to say a few words on today's session. Dr. Mridhu Sharma.
Thank you very much, Dr. Ajay. First of all, I would like to thank Speaker Dr. Ganesh Award for giving his valuable time and joining us at such a short interval. Thank you, sir. I would like to extend my thanks to our chairman, Engineer Amarjit Singh Walia, Principal Dr. Minakshi Nath, Dr. Deepika Bhandari, and all other staff members for successful conduction of Ayush Vibhodhini series. This ongoing event is only successful because of worthy eminent speakers. Thank you again, sir, for joining us. We are overwhelmed by your presence. Thank you, sir. Over to you.
Thank you, Dr. Mridhu. Hope today's session is going to be interesting. Now, I would like to request our keynote speakers, Dr. Ganesh Abad, to continue his sessions. Dr. Ganesh.
Okay, thank you for nice introduction, Dr. Ajay.
Thank you,
Thank you
sir.
for thank you for me giving the opportunity. Thank you for the principal and vice principal of your college. Initially, I would like to talk about practical approach of role of Swasthvritta preventing lifestyle diseases. Uh, Initially, before starting the session, I would like to know about what is the current scenario of students, so I can speak accordingly. It should be tailor-made. So they are in third year or fourth year?
Sir, they are in third year.
Third year. So which kind of topics you have
वैसे
covered?
तो डॉक्टर दिनेश वैसे तो ऑलमोस्ट फर्स्ट टू फोर्थ ईयर all students have joined, but we are focusing on third year. Swasthvritta ji in third year.
Okay, it might be something astonished question since I'm not from academic background. So I ask this question.
Okay, okay.
So, okay, I do practice in Pune since last around 15 years ago, and I do practice in diabetes and endocrinology with the integrative medicine approach. I apply our terminologies from Ayurveda, Swasthvritta particularly as far as lifestyle disorders are concerned. So, according to Ayurveda, the role of Swasthvritta in preventing lifestyle disorders, I will elaborate each and every disease firmly to the students. As you know, lifestyle disorders that are diseases that appear to increase in frequency as countries become more economic development. As our countries like India, like Indonesia, like Malaysia, Singapore, so these countries are becoming more industrialized and more people live longer. So they can include like obesity, hypertension, type 1 diabetes, type 2 diabetes, cerebrovascular accidents, as well as some type of cancers because of wrong food habits. So these all kind of diseases comes under lifestyle diseases. Uh, Tobacco, alcohol, nutrition induced cancers, as you know, arthritis, as you know, that because of obesity. Diet and lifestyles are major factors that are influence susceptibility to many diseases. So drug abuse, tobacco, smoking, as well as susceptibility to many diseases, as well as family history of any kind of disorders to uh, parents that might increase the susceptibility of the diseases. So, as the risk of developing certain diseases uh, in the especially later in the life, as per the World Health Organization, currently uh, half a billion, so around 12% of the world population are considered as a obese person. So, as far as obesity is concerned, as you know that body mass index, have you heard this kind of terminology, students? So it should be interactive session, so I can give you the lectures accordingly. Anybody? Do you heard the
Actually,
terminology
sir, students are mostly
completely?
unlistening.
Okay,
Yeah.
okay,
So
no
you
issues.
can
So,
continue.
okay. So body mass index is calculated as a weight upon height into meter square. The A calculated value is always determined in kilogram per meter square. So body mass index 25 to 30, that people is called as overweight. And apart from that, greater than 30 kilogram per meter square is called as obese person. So this is the kind of obesity and overweight difference is there. So, as far as obesity is concerned, what are the causes behind this obesity? As you know that sedentary lifestyle, junk foods, so these all kind of low exercise, uh, these are the reasons of obesity. So any person and as well as waist circumference, body mass index, these are the parameters to calculate obesity. So what is the modern view? As far as modern view is concerned, lack of neighborhood sidewalks and safe places for recreation. We don't have facility. for exercise, like not having areas like parks, sidewalks, and affordable gyms. Work schedule is completely busy. People say that they don't have time to physically active because of long work hours. Oversized people, as well as those have parental history of obesity as well as type 2 diabetes. I'm going to elaborate type 2 diabetes later on after obesity, because obesity is the motherhood of all lifestyle diseases. So oversized food portions, lack of access to health foods, that is not balanced foods, lot of carbohydrates people eat nowadays. As far as lockdown is concerned, since last 2 years, people have gained lot of weight in metro cities like Pune, Bombay, your Chandigarh, like cities. So that is a big charm as far as non-communicable diseases are concerned. So prevalence of obesity and sedentary behavior was significantly greater in these metro cities, tier 2, tier 3 cities. And the additional burden of obesity due to increasing sedentary lifestyle, junk food habits in some urban and economically sound areas is really alarming condition in India. So, what is the Ayurvedic view of Sthaulya? As you know that Ashtau Nindita Purusha, Sthaulya has been described in between these eight factors, that is 8 persons, that is described very well in Charak Samhita. I think your lecturer, Dr. Ajay, has described in previously lectures. So when there is a movement of buttock, breast, and abdomen, that is Nitamba, Udara, and Sthana, they become pendulous while walking due to excess of meta. That is called as a Sthaulya. In a Sthaulya patient, that is obese patient, that is sad mood or depressed, is called as a Sthaulya Purusha. His strength is rendered disproportionate with his physical growth, and due to obstruction caused by Meda Dhatu, there is an obstruction to the movement of vata, and this prakupita vata enters to stomach, increases appetite and absorption of food. As you know that his central nervous system always stimulates the hormone for appetite, that is called as a ghrelin hormone. And ghrelin hormone absorbs the complete nutritious atom of the food. If ghrelin hormone increases in the body, that which from the pituitary gland, that people eats a lot and there is no control on the satiety center. So this kind of sthaulya happens in these kind of patients. So what is the role of Swasthvritta in primordial prevention? As you know that there are four levels of prevention, that is primordial, primary prevention, secondary prevention, and tertiary prevention. So primary prevention role of Swasthvritta in obesity persons. Primordial prevention is the prevention of the emergence or development of risk factors in countries or populations groups in which they have not yet appeared. This is the true kind of prevention in lifestyle diseases like Sthaulya, and it is achieved through individual and mass education of regular exercises. So, Vyayama, till the appearance of features of Ardha Shakti Vyayama, that is exercise till increase rate of respiration, perspiration, feel of freshness, that is called as Ardha Shakti Vyayama. As a part of Dinacharya, as you know all of this, so I'm not going to elaborate Dinacharya and all that stuff. This can be done through the means of mass education and cultural practices. This is the primordial prevention to prevent Thaulya. So emphasis has been given in Swasthvritta on Samskara Swasthvritta includes good habits to be followed for lifetime to bring lifestyle changes, including diet, exercise, and weight reduction. Use of proper dietary habits as per Ashtavidha Ahara Vidhi Visheshayatana. So I think Dr. Ajay sir has described very well in previous manner Ashtavidha Ahara Vidhi Visheshayatana and Dwadasha Ashana Pravichar. So these 8 and 12 rules for taking diet from very beginning of life, that is childhood, is again a strong measure in preventing risk factors of from emerging lifestyle disorders. So role of Swasthvritta in primary prevention of thaulya, that is lack of mental exercise, and as result of all these following are the consequences. So other dhatus do not grow to the extent fat grows. Second thing, longevity is affected. Body movement is impaired due to looseness, as well as small quantity of seminal fluid. Weakness prevails as the equilibrium of distributed dhatus, bad smell of the body, excessive sweating. Kapha also increases as the fat is associated with kapha. Person cannot withstand physical exercise, excessive hunger and thirst. The treatment, as far as treatment of Sthaulya includes, that is a Pramitasana. Pramitasana means adequate quantity of the food. The next thing is Langana, that is fasting, Upvasa. That is very important to reduce the fat. Heavy exercises, Ruksha Udvartana, that is a part of a Panchakarma treatment, that is application of dry powder to whole body. That is, for example, Trifala Churna, Udvartan can be done. Ratri Jagrana, late night work is also very important. Uh, as well as Adhika Adhyayana, that is excess study, Chinta, use of certain medicines such as Trifala, Haritaki, Bibhitaka, Amalki, Shunthi, Nagar Motha, as well as Shilajita, that powders or that tablets we can use in the practice. So role of Swasthvritta in prevention of lifestyle disorders, Thaulya, the basic aim, the basic aim of the disease is by maintaining optimal health as well as being to its comprehensive approach that involves body, mind, and environment. Second, to give the best result to the person having this kind of disease like Sthaulya. So according to Swastharutta, a healthy person is one who remains well established in self along with the equilibrium of the three dosha, Vata, Pitta, Kapha, equilibrium of the Agni, equilibrium of the Dhatu, Mala, Kriya. So self is recognized by the good aspect of spiritual health of the body and mind and Indriya. Dietetic factors, lifestyle, as well as the environmental factors affect health, and disease is the result of disturbance in homeostasis of all above mentioned factors. So Staulya and Swastharutta has a great potential in preventing of all lifestyle diseases. Obesity can be prevented by intervention in its cycle of pathogenesis as early as possible, beginning from the avoidance of predisposing factors of the disease. So what are the general and specific measures? General measures include properly observing Dinacharya and Rutucharya, Sadvritta, self-control, and knowledge of various factors affecting health, good habits, avoiding food in excessive quantity, apathy, acharana, viruddhasana, avoiding Santarpanatad ahara. Primary prevention is action taken prior to the onset of disease, which removes possibility that a disease will ever occur in the future life. For this, extensive surveys are conducted. Free camps can be taken and high-risk people are identified as far as primordial prevention is concerned. So group to be advised to make certain changes in socio-economic behavior, food patterns, habits, as well as sleep cycle and lifestyle. So this include modification in lifestyle as per the guidelines of Ayurvedic classical texts such as Sadvritta, that is good life practices, non-suppression of natural urges, that is, Vegananda Dhare, Nidana Parivarjana, avoiding causative factors, and so on. So recognizing Purva Rupa of Sthaulya, that is very important factor to treat this kind of patients. So role of Swasthvritta in secondary prevention, now we will go proceed. Secondary prevention involves measures which are taken to halt the progress of disease at its incipient stage and prevent complications. Such measures which reduce meda and kapha, for example, heavy exercise, ruksha udvartapan, ratri jagran, pramitasana, langhana, ati maithuna, etc. are beneficial for patients of sthaulya. Use of certain medicines, that is madhu, amalki, shuntha, kshara, Nagarmotha and Shilajita, as we described it earlier. Role of Swasthvritta in tertiary prevention of Sthaulya. It includes all measures that reduce or limit impairments and disabilities and minimize suffering of the patient due to disease. Ayurveda has limited role at this stage because tertiary patient means that is morbid obesity. We call it as a morbid obesity. People is greater than around 40 kilogram per meter square BMI. So in this kind of patients, again, there is no role of Swasthvritta according to practice because these patients are very heavy and these patients may have symptoms like perspiration, lack of confidence, depression, type 2 diabetes, as well as cardiovascular diseases, those who are greater than 40 kilogram per meter square body mass index. So in these kind of patients, there are multiple surgical interventions like sleeve gastrectomy, that is bariatric surgery. So we are not going to detail in this tertiary obesity. So primordial, primary, and secondary. Up to that, we can prevent this obesity with this kind of all Swasthvritta measures. So obesity is the mother for all diseases, that is cardiovascular disorders, as well as transient ischemic attack, which is related to central nervous system. Again, cerebrovascular accidents, as well as type 2 diabetes. So all these diseases are related to obesity. So I initially described obesity according to modern as well as Ayurveda. Then we will proceed to, I think, diabetes. Will it be okay? I will try to find out my slide for diabetes. Just a sec. Okay.
Hello,
Unable to find out the.
Dr. Ajay?
Oh,
Yes,
yes.
yes, sir.
Yeah, sir, was there any problem, any interruption?
There is no
No,
problem at all. I was able to find out that particular PowerPoint presentation, but I am not able to find out. I will describe all the details in type 2 diabetes mellitus. Type 2 diabetes mellitus is a disease which is related to hyperglycemic condition of body. So in this, BSL fasting should be less than 110 and postprandial should be less than 140. So because of obesity, any patient can be land up into diabetes. So he is very prone for cardiovascular disorders also. So fasting should be less than 110 and PP less than 140. What are the parameters to monitor or identify type 2 diabetes? Basically, I would like to tell about the investigations. Everything is I'm describing here is completely practical approach in the clinic when you treating with the patients. So diabetes particular investigations I will like to elaborate, that is fasting, PP, and HbA1c. HbA1c is called as a glycosylated hemoglobin which is normal range is less than 6.5%, according to American Diabetes Association. So if any patient lined up after 6.5, that is identified as type 2 diabetes. So lack of insulin resistance, that patient may land up into type 2 diabetes. So type 1 diabetes, that is a complete 0% production of insulin in those patients. That patient may start from zero. That means day one age child can get type 1 diabetes till age of 18. That patient have type 1 diabetes. There is no any pathogenesis to identify type 1 diabetes. You can rule out from the test investigation called as a C peptide level. So if it is less than 5 nanogram per ml C peptide level, that patient may uh, diagnose with type 1 diabetes. So as far as Swasthvritta is concerned, or any Ayurvedic regime is concerned, we cannot do anything about type 1 diabetes. There is another third type of diabetes that is called as a gestational diabetes mellitus. So gestational diabetes mellitus patient may have a temporary diabetes during pregnancy period, that is ANC period. So even some Ayurvedic medicines, we have a lot of restrictions to use some medications because of some renal parameters may hamper. So we can only treat and prevent type 2 diabetes with Swasthvritta practices like diet and exercises. So low carbohydrate diet as well as Ardha Shakti Vyayama like brisk walk. We can get lot of sugar control as well as swimming, cycling, and skipping. That are very important exercises to be advised in type 2 diabetes. And to prevent type 2 diabetes, very important thing is diet. Low carbohydrate diet as well as balanced diet with proper metabolism, three dosha, sapta dhatu will be in balance. So accordingly, we can tailor-made the diet regimen to the patient. It should not be like that common diet chart to the patient. It should be with the Prakriti, body mass index. Since how long is the disease persist in the body, so we can consult with the patients accordingly. As you know, that cardiovascular disorders, that is the 30% of all death from the world, that is because of cardiovascular disorders as per the World Health Organization guidelines. So, as you know, Ayurveda is the foremost life sciences which describes ways to prevent and manage lifestyle diseases, diet management, lifestyle advices, biopurification, and detoxification procedures. We call it as a Panchakarma treatment. We can prevent such kind of lifestyle diseases, obesity, and type 2 also. So rejuvenation therapies like Rasayana Karma and medicines, as I described earlier, Shilajita and Trifala Churna. So we can prevent type 2 diabetes as well as Thaulya, that is obesity. What are the holistic approach? That is interventions targeted towards complete mental, physical, and social well-being of that particular patient. So we can prevent those lifestyle diseases with the help of holistic approach. Next, we will go to Sadvritta, that is code of conduct. As you know, in the Swasthvritta book, that Sadvritta, how to practice it. So, with the use of Sadvritta, we can balance all hormones, particularly about central nervous system hormones. As you know that four hormones are there: catecholamines, serotonin, dopamine, and melatonin. So these hormones, with the help of Sadavritta, as well as with the help of a Shirodhara, Dhyana, Dharana, and Samadhi, these four hormones can be balanced very well. And this has a lot of scientific evidence in American Journal of Therapeutics and PubMed. So this is all practical approach of this Sadavritta. As you know that Pradnya Prad, you might know very well. Prajnaparat. And Dinacharya and Rutucharya are the basics of Ayurveda, not only Swasthvritta. So early to bed, early to rise, as well as Trayopastambha, that is Ahara, Nidra, and Brahmacharya. These all are important factors to prevent any kind of lifestyle diseases. Uh, uh, none. The last one, that is yoga. Yoga may prevent role in as far as muscular exercises are concerned. So we can prevent insulin resistance of the body, and we can prevent type 2 diabetes very well, because stress factor is the major cofactor in the uh, developing type 2 diabetes as well as in further complications. I'm going to elaborate further complications in type 2 diabetes, because this yoga can prevent and can manage very well type 2 diabetes. So rather than using chemical or allopathy medicines, with the help of Ayurveda and yoga, this type 2 diabetes can be reversed. I have a lot of patients. So I have reversed more than 1,000 patients with the use of yoga and Ayurvedic treatment from my clinic. So Ayurveda emphasizes on the maintenance of health as well as the prevention of disease. So obesity, modern view, I told you, as well as Ashtonindit, I told you, type 2 diabetes, I have told you, type 1, I told you. I would like to tell the complications of diabetes, that is the macrovascular and microvascular complications. Macro means bigger and micro means smaller. So what are the macro and micro? Macro means cardiovascular disorders. So these kind of complications related to type 2 diabetes. And what are the micro? Micro is related to eyes, capillaries of the blood. So glaucoma or cataract can be developed in type 2 diabetes mellitus, as well as neuropathy, peripheral neuropathy can be developed in type 2 diabetes. So this kind of macrovascular and microvascular complications can be prevented with the help of Swasthvritta as well as Ayurvedic some regimes as well as some yoga practices. So accordingly, we can prevent these major two diseases, obesity and type 2 diabetes. As far as cancers and some diseases related to lifestyle, that is spine related problems, some postures, some sitting, like since last 2 years we are facing COVID lockdown periods. People are working from the home, so they are sitting like this and this. So this spine related problem also can be overcome by yoga practices and some good physiotherapy practices, as well as panchakarma procedures. So to conclude, as you know that to prevent lifestyle diseases, Ayurveda emphasis on the maintenance of health as well as prevention of diseases. Many interventions described in Ayurveda to prevent disease and to keep the balance between mental and physical health. There is no option in the allopathy or any kind of other pathy to make the balance between physical and mental health. So implementation of all these modalities has a great effect in promotion of health and prevention of lifestyle disorders in the life of that particular patient. So thank you very much, Dr. Ajay sir, and all the dignitaries. I have concluded my session.
Okay, thank you very much. This is enough from Dr. Dinesh. Now, anybody has any questions or query,
Yes.
he or she can ask. Anybody has any questions? Okay, sir, I think there is no question.
No
Thank
questions.
you very
So
much.
everybody understood very well.
Yeah, I
Because
think
this was not academic lecture. This was a completely clinical approach and practical approach of the Swasthvritta in lifestyle diseases. I have taken that one only, because I'm not associated with, as you know, any college or any
yeah,
institute. Yeah.
okay. So thank you, sir. Thank you very much for
Thank
your
you.
cooperation and for your time, valuable time. I hope
Yes. Thank
with big best wishes for your futures.
Yes.
Thank
Thank
you
you.
very much, sir.
Yeah.
Okay, thank you.